All right, we are now live recording. This is Andrea Powell with Corona Rising Surviving Now. This is episode 10, and we are here today for a special episode, a more intimate conversation about something that many people might not think affects them, but how we view our healthcare, how we view going into a hospital now more than ever has very critical consequences. We have thousands and thousands of people who are experiencing symptoms of COVID. We have 100,000 people who died in the United States from this pandemic. And that's on top of all of the stress that we're feeling, people losing jobs, not knowing about their future. That stress produces more health issues. So now more than ever, we need to be able to trust that if we're going to a doctor, be it for a checkup, be it for symptoms of COVID, for stress-related symptoms, anything, falling off a bike, we need to know that when we walk in, that we will get quality care that is not dependent on our race, not dependent on our gender. The reality is, though, that healthcare actually is not something that's neutral. My experience and other people's experiences may be different based on our race, based on our gender expression, based on economics of where we live. Different people, unfortunately, have different experiences. And I wanted to start this conversation first by welcoming my colleague, Tutu, who is part of Corona Rising's advocacy team. I also wanted to give a little bit of a background because today we're going to be talking about the recent Trump administration's repeal of the Affordable Care Act clause that protects those who identify as transgender LGBTQ from discrimination in a healthcare setting, and why that's so important to, one, acknowledge and understand. I don't think that many people actually know this is happening, and two, to really personalize this, because you read about it and you don't, if you don't identify as transgender or have people in your personal life who do, you may not think that this is actually all that big of a deal, but it has pretty critical consequences. So I wanted to back up a little bit before Tutu and I start the conversation and say that in my previous work, one of the things that I did is work with my team to found a safe house. And the safe house was very tiny. It was basically a room with a closet in the back, and we would just all pile in as many as we could fit of young survivors of sex trafficking, human trafficking in the nation's capital. It was the first home specifically designed for survivors of trafficking. And I remember telling a colleague from another organization that we did have survivors who identified as transgender who were staying in the home, and she stopped and said, "Wow, that's so progressive of you, as if I should get like a cookie for this." And I said, you know, it never crossed my mind not to admit someone who identifies as female is a survivor of trafficking. I never thought, well, I'm going to be progressive and admit this person to my home. If they said they were female, I said, okie doke, and let's go. And that was it. But I had a really interesting and beautiful experience with Tutu right in the early days of the home getting started. I met Tutu, actually, I was on the phone, and a law enforcement official called and said that this young woman was in the hospital, in Children's Hospital. She was a teenager at the time, and she had escaped a pretty terrible trafficking situation and really needed a place to go. And we were able at that time to have her come join us at the house. And, you know, everything was going great. And, you know, we were looking for, you know, counseling and jobs and figuring out legal issues. And one night, Tutu wasn't feeling well, and it really got to a place where we needed to call 911. I was really concerned that her breathing was shallow, and just wasn't sure she was going to make it, to be honest, and was pretty scared. It was just the two of us in the house, and I thought, you know, oh my gosh, this person is going to make it. I'm going to make sure of this. And so I called 911 after trying to call her doctor and getting the runaround. I mean, I was really worried that there was a complication with some of her medications, and I'll let her speak to her health background in a moment, but there was some medication that she had that were causing complications. We called 911, and the EMTs got there, 2 EMTs, and they were so rude. They were physically aggressive, kind of pulling her around. I wasn't sure she should be moved that way. They were dragging her into the back of the ambulance. They tried to kick me out. They told me that she was probably just being flamboyant or dramatic. At this point, Tutu wasn't really, I don't think really heard what they were saying, but I did. And I was like, what do you mean? Like, I mean, she's not being dramatic. She can't breathe. That is, that's something to be alarmed about. So it's not dramatic. It's a crisis. And the two EMTs were being very aggressive. At one point, I was like, are we doing some kind of shtick where like you are being mean to keep her awake and to keep her like active? Like, I don't, like, what's the deal? And we proceeded this way all the way to Children's Hospital. And from there, Tutu was admitted to the hospital, and frankly, from there things were fine. You know, she had an excellent care team, had a history of that hospital supporting her. So overall, we had a pretty good experience. I was there with her for about 12 hours. And obviously Tutu's fine today because she's here. So there's no cliffhanger here. But that was my first experience in understanding that how they were viewing the situation, how those EMTs were responding was based on a stereotype that because Tutu is transgender, that she was making it up or being dramatic or just wanted to go to the hospital, which was crazy to me. I was like, when they said, well, she just likes to come to the hospital, I was like, I don't know where you're getting that information. It's not from me and it's not from Tutu, but we were having a pretty good time in our house. So no, we did not want to go to the hospital at 4:00 in the morning or whenever it was in the middle of the night. And so that I wanted to start the conversation with that and, you know, acknowledge that I think Tutu and I both bonded over that experience, but it was very, very dramatic. Tutu, I wanted to, start with saying, you know, I'd love to hear a little bit more as we've been talking about how you felt when you learned that the Trump administration had repealed the clause to protect LGBTQ identifying individuals from discrimination in a healthcare setting. How did that make you feel? You know, what emotions did it bring up?
My instant emotion, outside of like my thoughts and everything, but like my instant emotions was sadness and fear, because I like how you just explained, I've gone through multiple situations in the healthcare field where I've been discriminated against because of my gender identity. I do have sickle cell anemia. To people that know what that is, to people that don't, it's a blood disease that you get genetically from both parents, which basically is lack of oxygen in your red blood cells. So when your blood basically just gets clogged up in one spot, and it just causes excruciating pain, and it causes breathing problems as well. But yeah, I was instantly scared, because I'm just like, I remember the days where I was going to the hospital and, you know, I was being treated differently, or I wasn't being treated at all just because of how I you know, self-identified. But and then just going from that to a time where it's okay for me to go to the hospital and say, oh, I'm transgender, and being, you know, taken care of. Just saying that, it was just like, wow, those days are over now, because he just took that away from us. So it was just really scary and hard to like kind of take over, you know, take in.
And if you could speak to President Trump and those who supported this move, what would you say to them right now?
Well, first, let me see. I honestly would say, if I was speaking to Trump himself or his administration, I feel like before they sit there and judge or stereotype transgender people, no matter what their race is, I feel like you should kind of get to know the community more better and understand like what the transgender community is exactly. You know, like not everyone in the transgender community has, how can I say, good intentions as far as when they want to go to the hospital, because I've seen it firsthand. But I feel like you shouldn't fault the whole community for a few, you know, bad apples. And I just kind of feel like, just sit back and just think, if that was your children, you know, that decided that they wanted to identify as the opposite sex that they were born, would you want them to actually go to a hospital and be discriminated against? It could be a life or death situation, or it could just be something as simple as just a back pain. But still, just think about it being, hello? Oh, yeah. Just think about it being their kids. I just kind of feel like they don't really get it because, they don't have no close connection with the community at all. So it's just like, let's just take away their right of being, their right of being able to go to the hospital and being treated fairly. So
and you actually had experiences recently, in the last couple of weeks, or, right on the day actually that this announcement was made.
Yes, I did.
Yeah, so tell me a little bit more about that and what, how this news affected that experience.
So the day that happened, I literally had just started feeling trouble breathing. Felt like it was a ton of bricks on my chest. And so I was like, all right, let me go to the emergency room and just kind of see what's going on, because at my job, with Amazon, they just want to make sure, that everyone's clear of COVID and stuff like that. But I honestly was scared to go, because I'm like, all right, I'm reading this, and he just reversed the whole act of being able to go to the hospital and be treated fairly. So it's like, now if I go there, are they going to even see me, or are they going to just see me, waste my time, and then just discharge me? So it was just a scary feeling. But I went and I was treated. And the first thing that the doctor said when he walked in was, he was like, your ID says male, but you present as female. I'm like, yeah, I know I'm transgender. He was like, well, I don't know how to, refer to you. And I'm like, miss. And so he was like, well, I don't want you to think that is something that I care about or we care about, because our main concern is your health. And just hearing that from my doctor was very, very comforting for me at that moment, because I'm like, all this fear that I had before I got here, and and that was my first time meeting that doctor. He just, he wanted to make sure that I was comfortable. And so I was very, very pleased to, have a good experience, especially on the same day that the reversal happened.
Yeah. And I think that shows that, this is a very individualized, personal journey. And, different doctors, different hospitals are going to respond differently. So it's not as if, I think the reality is, it's not as if this piece of legislation, enacted or not, protected or not, is necessarily going to change someone's attitude, because while that clause was in place, you also had very negative experiences. And
Yeah.
so it's, so tell us a little bit about, some of those challenges that you've faced, because I think a lot of listeners don't really understand what are the myriad ways in which discrimination can play out in that setting.
Okay. So, like I said, I have sickle cell, and I won't, when the clause was in place, I would probably say like last year, close to the end, I had to go to the emergency room. And when I went to the emergency room, went through triage, was sitting in the waiting room, I see people come in after me, and they're just going straight to the back. They're coming in for itchiness or, red eye or whatever. Something that
Basic
wasn't,
stuff.
Basic stuff. So I walked up and I'm like, hey, I've been here sitting in the, the waiting room for about an hour, 2 hours. What's going on? I'm in pain. That's when someone came from the back and got me. When I got to the back, my doctor came in, very respectful. It was the nurse that I got. And it for some reason, I felt like every time I went to that hospital, they gave me the same nurse. I feel like she probably asked for me or something, because when she came in, it was like, you have to put a protocol for sickle cell patients when you go to the hospital. You have to give them an IV, draw blood, so you can get them fluids and medications. She didn't do any of that. She just came in, asked me a few questions, and then just walked out. And I was sitting there for hours. with no treatment. My doctor came back and was like, oh, are you still in pain and stuff like that? I'm like, yeah, I didn't even get an IV, no one drew blood, nothing. And so when I told him who my nurse was, he went and said something to her. So when she came back in with an attitude.
Right.
And I asked her, I said, you know, did I do something to you personally, or, you know, like, what's wrong with you? And I already knew what was wrong with her because, like I said, her interactions with everyone else that came in, it was normal. Hi, how you doing? She greeted them. She treated them with respect. But when it came down to me, when she saw that my wristband said male, but then when she sees me, I'm presented as female, her whole attitude would just kind of change. And and now that I'm thinking about it, I kind of feel like people that are like that in the healthcare field, that discriminate against transgenders, I feel like they're more so not just not understanding of the community, but I feel like they are fearful of the community because of the stereotypes that are put out into the public about the trans community, you know, whether we're fabricating something or we're being dramatic or we're just outright lying. And, you know, it's just like everyone's not like that. You know, you have to kind of give someone the benefit of the doubt. And she never did that. Every time I got to the emergency room, it was just, I'm sitting there in pain. I remember actually one time when I actually had called you and I told you that I had got assaulted on the metro. Mm-hmm. And then when I walked out, the police had assaulted me. And when
I remember that very clearly, yes.
Yeah, and I couldn't even walk. They locked me up. Okay, when you get locked up, they're supposed to ask you for if you need medical attention. I told them I couldn't even walk. They took me right to the holding cell, realized I didn't have a case, and they dropped it. But when I was walking, it was me and my friend. I'm like, I don't think I'm going to make it to the bus stop. And I was just pushing, got to the nearest fast food. It was close to like downtown DC area, but I was like close to like Friendship Heights. And I got to a McDonald's and I called 911. And when I told them what happened, they were like, you should have came to the, you know, the emergency room. They should have brought you here. So when I got there, the same nurse that always is just mistreating me and she just has a stink attitude. She came in and this time she had a partner.
Okay.
Her partner actually had to check her because she wasn't even she was going to do the same thing, just come and ask me questions and just walk out. Her partner was like, aren't we supposed to do IV? I think she was doing like nurse training for a new nurse. And so she's like, aren't we supposed to do like IVs and stuff like that? This is exactly what she told her partner. Well, if you're going to do that, you can, because I'm not touching them. And I was just sitting there like, in my head, I'm thinking like, am I filthy or am I dirty or something? Like, what is she trying to, you know, say? But it's just like, it's hurtful to know that someone can just mistreat you just because how you identify yourself or the color of your skin. It's just crazy. But just looking back now, I wouldn't say I honestly think if I'm put in a situation like that again in this time, I don't think I would react in an angry way or upset way. I kind of just would, how can I say? I don't want to say pray for them, but yeah, I mean, I guess so. Pray for them and just keep it moving because I have a better understanding kind of sort of people like that. You know, I kind of have an understanding that they're just not understanding of the community or they're fearful because of things that they heard or seen probably. And so, you know, they're curious. They might just be curious, you know, because most of the time I feel like people that don't support something is because one, they don't understand it, they're fearful of it, or they're curious.
Right.
And so I think I would just have a different approach if I was to ever be put in like a situation where I was being discriminated against in the healthcare field.
Well, in that whole scenario that you just shared, I remember, you know, to help edify this for the audience, the whole situation started because you were actually in training to become a nurse. You were in your scrubs and
yes, I was just leaving school and I was so upset because I'm like, my professor, he's like, as long as you have the scrubs on, which had the school logo, he's like, you know, walk around. It doesn't matter if you're on the train and the store, as long as you're on the scrubs, maintain a professional, manner. And so when I got on the train, it was me and my friend who was also transgender. And the thing about it is, it was so crazy, is the whole incident started because a lady that was on the train decided to spray us with mace as we're getting off the cart because we were transgender.
Right. And so the whole scenario started because of discrimination on an individual level. And then the police didn't believe you, the Metro police. And so they assaulted you instead of actually helping you. And so you actually had injuries from what the Metro police did. So the whole story starts with a person discriminating against you, the police discriminating and assaulting you, and then not even following appropriate police protocol to get you to the hospital. And then you get to the hospital and have to fight to get care there as well. And meanwhile, the entire time you're in training to become a nurse. What inspired you to become a nurse? What inspired you to become a nurse?
And what inspired me to become a nurse? What inspired me to get into the medical field, period, is one, as a child, I always said I wanted to be a pediatrician, because when I used to go to Children's Hospital, the nurses they were so friendly. Like, if anyone has been to Children's Hospital in Washington, D.C., the nurses there are so sweet. I haven't been recently because I'm an adult now, but when I was going, they were very sweet. They made you feel like you were at home. They made you feel like if you didn't have anyone outside of the hospital, you had them. And that was actually the case for me. And so that's where my flame of wanting to get into the medical field started. But as I got older and I started going through my experiences as far as like discrimination and it wasn't just the discrimination, it was like the discrimination on top of the nurses or doctors malpracticing and lying about diagnoses or symptoms. I'm like, but let me just educate myself more on the healthcare field and kind of see if, I want to know what they know, you know what I'm saying? So when next time I'm in this situation, I'm able to defend myself or, speak up for myself on a level that they will understand, which is medical terms. And so me going to school to become a nurse actually helped me a lot in certain situations, not some, because some people just didn't care. But in most situations, it helped me out a lot because one, I would either have my scrubs on, or once they started treating me unfairly and trying to how can I say, I don't know the word to say, misdiagnose me, being as though I had, being as though I was educating myself more on the healthcare field, I was able to be like, no, what you just said, that's not right, that's wrong, or that's incorrect. Or like I said, sickle cell patients protocol, when you first come in, that's a priority too. Meaning as in, if you're going straight to the back, fluids, IV, all that's protocol. Some nurses will tell me, oh, that's not protocol. Oh, anyone that knows in the healthcare field at any hospital, sickle cell is a priority 2, priority 1, depending on how bad the crisis is, and you have to get the person medicine and fluids immediately. So it was just like, now that I'm in nursing school, and now that I've graduated and stuff like that, I'm thankful because I definitely know how to better speak up for myself when it comes to speaking to nurses and doctors. And just also, I wanted to get into it because I saw what I went through as far as the discrimination, and I eventually want to somehow, I don't know when, somewhere down the line, incorporate my advocacy work with my nursing for the trans community. So that's what really got me started into the nursing field.
I think it's beautiful and sort of full circle, and just shows that that what's happening today, the discrimination that now can go unchecked, because again, right? I mean, it's not like you had great experiences while this clause in the CARE Act was in place, but the difference is that with that clause in place, you have better opportunities to stand up against that discrimination, to hold a hospital or to hold an individual provider accountable. And there's still ways to do that, but to have a bold statement from the highest office in the country, from the White House, saying that they don't believe that it's important or necessary.
It
That
will be kind of hard to do
that's
so
a
now.
slap in the face, to be honest.
Yeah.
And, here at Corona Rising, we know that about 10% of the survivors we serve identify as transgender. And we had it never crossed our minds to not be wanting to support you. And I actually remember when you told me you were transgender, and I had known the whole time, and I could tell you were nervous to tell me, and I thought, I
Because I
had no
thought, honestly, when I was scared to tell you, because the day in the hospital when the day in the hospital when I left my trafficker at that time, and they brought me there, and they kind of was asking, they were doing the whole rape kit and everything. That right there alone scared the crap out of me, because that was my first time ever. I'm like, I'm in Children's Hospital. I didn't even know they had these things in a hospital for kids, not saying that I was oblivious to the fact that kids get sexually assaulted and things like that, but I just never knew they had that in the hospital.
Right.
When they were like they were going down the list and calling programs, they were like, oh, that's not a good fit. That's not a good fit. That's not a good fit. A social worker that was not even in the room, she came in the room and she said, I actually know about a program who helps people who've gone through sex trafficking and stuff like that. And when I said, what do you mean sex trafficking? And she was like, well, what you explained to me, your situation, she said, that is what we identify as sex trafficking. And at the time I didn't know that. So I was like, okay. And so she told me about Fair Girls. And when I said, well, are you sure I can go there? Because it's called Fair Girls. And, I don't want to get there. And then I tell them, and then they're like, oh, well, you can't stay here, because where am I going to go? But when I told you, your reaction, your whole energy, it wasn't like negative or anything. It was very positive, very, very warm, and very comforting. And so I don't know, how can I say, I just felt like it was a huge weight lift off my shoulders to know that, okay, I'm in a safe place, and I'm in a place where they're not judging me for who I am or how I identify myself. And so I was very thankful for that.
And honestly, again, as I said before, for me, I don't think that someone who acts like that should get a cookie. I don't think that should be basic human kindness, basic humanity right there. Just being non-judgmental, being open, being inclusive. I won't go into the details for this episode, and it's not my story to tell, but you had been through so much at that point in the last few weeks, but in your life, and knowing that we had this tiny, frankly, kind of crappy, cheap room in Northeast DC that we called a safe house, that we could invite you to come into what looked like a ridiculous college dorm, and that you wanted to be there. We were happy to have you, and watching you go from there to groups, to being in theater performances, to becoming a nurse, to overcoming trauma. I mean, frankly, I wanted you to sue the police department after what happened to you, and you didn't, and I respect that you chose to move forward in your life. I think but everybody in your care team at Fair Girls, and then at Corona Rising, becoming one of our team members, you've always exuded such positivity and strength and frankly just integrity, and so many individuals in the transgender community with whom I either work with as former clients or colleagues, I just, it never crossed my mind to treat anyone differently. And so I hope that that the lawsuit that Stepstone Johnson is doing with Lambda to reverse the Trump administration works. But I also hope that this is an opportunity for those who are listening, as well as those around the country who are learning about this situation. I hope it's an opportunity for them to understand that there's never a scenario in which someone should be discriminated against based on their gender identity, but also these are real lives. These are real people. That nurse who was turning you away, what if you had been going into cardiac arrest, which is at a real risk with someone with sickle cell anemia.
Yeah.
I remember coming home the next day after leaving at the hospital, my colleague taking over. We were watching over you like a hawk because
I know you guys were on rotating shifts. I remember. Oh my
we
goodness.
didn't trust the hospital to take care of you. And, you know, after all the discrimination you'd experienced, we were scared. And so we were watching over you like, like a little, you know, social worky hawk. But I came back to my colleague that day at the office and said, I think she almost died. Like I really, like I was in shock, you know, and I was in shock that these EMTs, that I had to fight them. And I'd never experienced that. And frankly, I kind of wish I'd made a report. But I guess we were so darn grateful you were alive that nothing else really mattered. But this has real consequences. And when I read about the repeal of this element of the Affordable Care Act, and I saw that Steptoe and Johnson and Lambda were trying to sue the government to reverse this order, the first thing I thought of was that night with you, and the fact that I'm so grateful that you're here as my colleague, and now having the opportunity to share our journey together, your journey, and to put faces on this experience. This is not a statistic. You identifying as transgender does not make you over here and me over here as a cis white female. I consider this a sisterhood, and what impacts you impacts me, and that is something that is very important. I wanted to close, because we do have other footage we're going to be including in this episode. I wanted to close with something that was also a little bit personal, but my little girl, when she was about 4, who I rarely talk about, but when she was about 4, she met you, Tutu, and
Yes.
she asked you if you were a boy or a girl, and you said a girl, and then you told her that you were a boy and that you now are a girl. And Veronica looked at you for a minute and said, "Cool."
Yes, I remember that.
And then she took your balloon and ran away.
Yes.
But that's, if we could all be, if life could be as simple as a 4-year-old saying, "Cool," then we would be in a better place. But we're not. We have people like that nurse who you're talking about, and much worse, because there are many other stories involving you and other transgender survivors who were in my who were severely discriminated against right in front of my eyes, to the point that I had one survivor who I had to tell her, because she needed treatment for substance abuse, and they were not going to let her in, and they said it wasn't a crisis. I knew if she went back to her house in that state of detox that she could go into shock and die. It was a really bad situation. I had to tell her, "You have to tell them that you want to commit suicide. That's the only way they'll let you stay." And she was not in that.
And that's crazy that you have to do something like, you have to go to those drastic measures just to receive treatment.
Exactly, because she was not suicidal. She looked at me like I was crazy, and I was like, I'm so sorry to tell you that that's what I think we have to do, but I don't know any other way. And as soon as she said it, then they provided care begrudgingly, but otherwise they were going to let her go. And again, the sentiment that I got from the nurse was, "Oh, she's come in here before. She's so dramatic. You know how they are. They're all like this, blah, 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 druggies." And it's like, I don't know what you mean by they, but this person, this individual in front of you, needs care now. And I had to stand on a chair like a crazy person myself, hollering. And that's how we got the head doctor to come over, because they were like, "Whoa, that white girl's going crazy." But it should not. We should not have to go to these extremes of jumping on chairs and saying we're suicidal, and frankly having to be the very thing that they accuse us of, like being overly dramatic. Well, I would be pretty dramatic too if I was in the hospital full of pain and nobody wanted to treat me. I wouldn't call it being dramatic. I'd be calling it advocating for myself so I don't die.
Right.
That's not dramatic. That's saving your own life. And anyone who has to do that because care providers won't act, that's a situation of a human rights abuse. And anyone who participates in that should be ashamed. But I wanted to thank you for being on the show. We're going to be putting this piece together a little bit differently. It'll be airing in about a week, but Tutu, I just have so much admiration for you, and I hope that you have a beautiful day in hot,
Yes.
humid DC, in the middle of
Yes.
summer. As always, you are just a delight to work with. But I will
Yes,
talk to you
you
very
as
soon.
well.
This is Andrea Powell with Surviving Now, episode 10, and we are signing out. Thank you so much, Tutu. Have a beautiful day. Bye.
You too. See you guys. Assistants and radiologists out there, anyone that's working in the healthcare field, I truly, truly pray and hope that despite the reversal of the protection to protect trans people from being discriminated, being ruled out from getting the proper care in the healthcare field, I really pray that you guys just stick to your own morals and your own beliefs, and honestly treat us as if we're one and the same. I honestly really hope that due to this whole law change that people are still able to go to the ER or the urgent care, especially with ones that have health problems, and get the proper care without being looked at as other or as an outsider, and that's something that I definitely don't want to go through because I have sickle cell and I've had that since birth. It's something genetically that I was born with, and definitely with me being in, the midst of transitioning and things like that, I definitely don't feel like, I don't know if I'm able to go to the emergency room, urgent care, and get proper care now because of what has just taken place by Trump and his administration, which is so absurd because I feel like it doesn't matter who you are, black, white, yellow, orange, Hispanic, fat, tall, short, straight, gay, bi, lesbian, trans, pansexual. It doesn't matter. It doesn't matter what you are, who you like, and how you identify yourself as. If there's a health issue going on, then it needs to be addressed, especially if it's life-threatening or whatever. And I feel like, to the trans community, don't let this stop you. Don't let this break you, because just going through an everyday life as it is hard enough, definitely with everything that's going on. So yeah, I just wanted to make this video to kind of bring light to that topic. It was something that really, really bothered me because now you just don't know if you're able to go to the emergency room and get care just like everyone else. But definitely shout out to the Supreme Court for getting it passed and making sure that it is illegal to fire someone based off of their gender identity or sexual orientation. So definitely thank you to the Supreme Court. But I feel like we need to start somewhere, and we need to definitely make sure that everyone, gay, straight, bi, black, white, Hispanic, orange, blue, trans, receive all of the same type of health treatment and plans from doctors and providers. So yeah, if you're with me and you want to definitely fight to see a change, definitely, please watch this video, talk to your friends. If you have any trans friends, just kind of talk to them, get their insight of how they're feeling right now and everything. Hi, you guys. My name is Tutu Scott, and I am a survivor advocate for people who have gone through sexual assault, domestic violence, and human trafficking, and many more things to advocate for. I'm just an advocate for anything that I truly believe in. And I was just asked to do a video and just kind of like talk about my new job with Amazon, which I'm so excited for, and why I was interested in the job. Where did I hear about the job? And one, I found the job on Instagram. I'm a social media person, so I'm always on the internet. I'm always researching and Googling things. And just so happened I was on my Instagram and I was swiping and I saw they were hiring. When I normally see things like ads for things that are hiring or like things to buy on social media, it's a little like iffy for me. I don't really, but I was like, hey, let me just go ahead and just take a shot at it. And it was legit. And I actually started last week. I love it a lot because it gives me the ability to schedule myself at the times and days where I know that I would definitely be available. Great pay. And that was the real main reason why the job was important to me. One, not only because I wanted to kind of jump into something more different than what my normal jobs, but also because of the financial. Yes, most definitely, especially with everything that's going on during the pandemic. I feel like it's our leaders and governments, they really don't care about the everyday people who are out here struggling to make ends meet or to pay their bills. I feel like that they're not living our lives. They're not living our everyday experiences. So they're not going to be able to relate, and they're not going to be able to understand. I feel like what we go through as a community on an everyday basis. But there's a topic that I wanted to touch on outside of my job, and I saw something about how Trump and his administration has basically reversed the law that was put in place to protect trans people in the healthcare field. Now, I am someone who works in the healthcare field. That's what I went to school for, to work in the healthcare field as a medical assistant. And coming from someone who can relate to, being, how can I say, discriminatory, how can I say? Someone who can definitely relate on a personal level of being discriminated against in the healthcare field for their sex or their gender identity, as a patient and also as a healthcare provider. I just really am. This video is for all of the doctors and nurses and physician assistants and radiologists out there, anyone that's working in the healthcare field. I truly pray and hope that despite the reversal of the protection to protect trans people from being discriminated, being ruled out from getting the proper care in the healthcare field, I really pray that you guys just stick to your own morals and your own beliefs, and honestly treat us as if we're one and the same. I honestly really hope that due to